Your hospital or organization has decided to adopt BIOPATCH Protective Disc as an essential component in its protocols for use around percutaneous devices such as central line catheters. BIOPATCH is intended to reduce the incidence of catheter-related bloodstream infections, local infections, and skin colonization of microorganisms commonly related to CRBSI in patients with central venous or arterial catheters. This program is designed to demonstrate how and when to use BIOPATCH. What is BIOPATCH? BIOPATCH is a protective disc consisting of a proprietary polyurethane foam impregnated with chlorhexidine gluconate or CHG, a proven broad-spectrum antimicrobial agent. BIOPATCH is engineered to provide CHG in a sustained-released formulation, which inhibits bacterial growth under the BIOPATCH during a 7-day period. A controlled, randomized clinical trial consisting of 687 subjects with 1,699 central venous or arterial catheter insertion sites conducted at 2 centers demonstrated that the use of BIOPATCH resulted in a 60% reduction in the incidence of CRBSI and a 44% reduction in the incidence of local infection. Scope and magnitude of CRBSI. Catheter-related bloodstream infections, or CRBSI, a significant cause of hospital morbidity and mortality, is a critical issue facing hospitals today. According to the CDC and NIST, the national average incidence of BSI is 1.5 to 5.3 per 1,000 line days. The prevalence of infection-attributable death with CRBSI is 12 to 25%. The incremental cost to treat each episode of CRBSI is estimated to be from $34,000 to $56,000. It is estimated that U.S. hospitals incur as much as $2.3 billion per year as a result of CRBSI. CRBSI, pathogenesis and prevention. While CRBSI may occur as a result of the transfer of pathogens from the healthcare professional or the catheter surface, the majority of CRBSI originates from the patient's own skin. The physiology of the skin has everything to do with a major source of catheter-related bloodstream infections. The surface of the skin is a rough and uneven terrain, providing protected places for bacteria to flourish. Bacteria colonies exist not only on the surface, but below the surface as well, particularly within the hair follicles and sebaceous glands. Skin antisepsis with an antimicrobial such as ChloraPrep will kill bacteria on the surface level, but it never completely disinfects the skin. Recolonization by the resident microflora can occur very quickly. Without continual suppression, bacteria on the skin surface can migrate along the catheter tract, elevating the risk of CRBSI. The CDC recommends a 7-day dressing change protocol, which has created the need to protect the patient from the effects of their own resident microflora for up to 7 days. The unique properties of CHG, combined with the proprietary delivery technology of BIOPATCH, provide proven sustained antimicrobial action for up to 7 days. By applying BIOPATCH immediately after insertion, we can prevent recolonization of the local skin flora. How BIOPATCH is received. BIOPATCH is delivered sterile in single-use packaging. Depending upon your facility, BIOPATCH may be received in boxes of single sterile protective discs or as a part of a dressing change kit, insertion kit, or tray. BIOPATCH is a protective disc that comes in 3 sizes to accommodate a wide variety of vascular and non-vascular percutaneous devices. Application of BIOPATCH. Some bacteria will invariably attach to the catheter surface as it passes through the skin layers, hair follicles, and sebaceous glands. All surface transient and resident organisms and up to 80% of the resident organisms in the stratum corneum can be removed by properly preparing the skin. Before insertion, be sure to cleanse the skin surface according to hospital protocol. A 1 to 2 minute clean scrub with a chlorhexidine preoperative skin scrub 2% CHG cloth such as Sage or Hibiclens is recommended. Following the preoperative skin cleansing, a surgical site prep is best accomplished by the application of 2% chlorhexidine gluconate, 70% isopropyl alcohol such as ChloraPrep. Prep the skin using a vigorous back and forth scrubbing motion, then work outward to the peripheral area. It is important to allow the area to completely dry for a minimum of 30 to 60 seconds. Maximum sterile barrier precautions prevent cross-contamination of transient organisms and protect the skin preparation. Insert catheter into prepared skin area. When fixing the catheter in place with a suture or a sutureless securement device such as StatLock, leave enough room for BIOPATCH to lie completely flat against the skin. Failure to leave enough room will prohibit the BIOPATCH disc from 360-degree protective coverage. Remove BIOPATCH protective disc from the sterile package using aseptic technique. Note that there are two distinct sides to the BIOPATCH disc, a blue side which always faces up away from the skin, and a smooth white foam side which must always be in direct contact with the skin surface. An easy way to remember this is blue side to the sky. Place BIOPATCH around the catheter or pin site with the CHG impregnated white foam side in direct contact with the patient's skin. Make sure that BIOPATCH is not laying on top of the catheter hub. When aligned properly, the pre-cut slit allows for an easy release of the catheter when the transparent film dressing and BIOPATCH are removed. If the slit is not properly aligned, the catheter can become trapped between BIOPATCH and the transparent film. Make sure the edges of the slit are touching. The BIOPATCH protective disc needs 360 degrees of contact around the catheter for maximum efficacy. Secure the catheter and BIOPATCH to the skin with a transparent dressing and date it, consistent with hospital protocol. In vitro testing has shown that once correctly in place, BIOPATCH provides a zone of inhibition that extends its antimicrobial action beyond the disc itself for up to 7 days. BIOPATCH will absorb up to 8 times its weight in fluid and remains effective in the presence of blood and wound fluid. Change the dressing as necessary, in accordance with facility protocol. Dressing changes should occur at least every 7 days. However, dressing changes may be needed more frequently with highly exuding wounds. Please refer to your facility's protocol for dressing changes. When changing BIOPATCH, first remove the transparent dressing by picking up the corner of the dressing and stretching the dressing away from the catheter, holding the catheter in place. The dressing will partially lift. Peel back until resistance is felt. Repeatedly stretch and peel as necessary until the dressing is removed. BIOPATCH will remain attached to the transparent film dressing, so removal will be simultaneous. Common questions. How is CHG released? BIOPATCH uses proprietary technology that utilizes the heat and moisture from the patient's skin to deliver a clinically effective amount of CHG to the skin for up to 7 days. What should I do if the BIOPATCH is full of blood? A clinically effective amount of CHG is delivered even when BIOPATCH is completely saturated. BIOPATCH will remain effective in the presence of blood. However, you should refer to your facility's protocol for dressing change. Can BIOPATCH be used on neonates? BIOPATCH has been used in pediatric and neonatal populations. BIOPATCH should not be used on premature infants less than 28 weeks gestation or with very low birth weight, less than 1,000 grams. What if BIOPATCH appears yellow when removed from its primary packaging? Over time, BIOPATCH may turn yellow in color. This coloration does not reduce the antimicrobial efficacy of the BIOPATCH. However, please refer to the use-by date of this product printed on the packaging. Can BIOPATCH be pinched or flattened to achieve 360-degree coverage? BIOPATCH remains effective when flattened or conformed to fit specific applications. What role does BIOPATCH play in a bundled approach to CRBSI? Bundling typically refers to an approach which utilizes multiple techniques and technologies in combination to reduce the incidence of CRBSI. BIOPATCH is an essential component in that it is the only device available that can suppress the patient's own microflora for up to 7 days. For additional information or technical support, contact your local BIOPATCH representative or call 1-877-ETHICON. That's 877-384-4266. For full prescribing information, Visit our website at www.biopatch.com.